Good morning, everybody. Can everyone hear me? Okay. We're going to get started. I'd like to welcome you all. Some of you were here last night for our reception and for our 3-hour certification training, and some of you are just starting out fresh today. It is going to be a great day. As you know, the title of our conference this year is Strength Through Collaboration and Education, Moving Ahead with IHSS. I like the moving ahead part especially because we're not going to let anybody destroy our program. We're going to keep moving ahead. Thank you. I want to thank our conference sponsors who really make this possible, and that is SEIU California, United Domestic Workers of America, UDW, CUE, California United Home Care Workers, and CAPA, the California Association of Public Authorities. So thank you very much. And I also want to thank the Conference Planning Committee, who have been working really hard on this conference for at least the last 4 or 5 months. And that is Janet Heinrichs Canterbury, Executive Vice President of SECA. Jane Cardis, Mendocino County Advisory Committee. Melissa Kinley, our Central Regional VP from Sacramento County. Sandy Barca from Los Angeles County, and also a SECA Southern Vice President. Ethel Webb, who couldn't be here with us this weekend, Northern VP with SECA, Shasta County. And Janie Whiteford, SECA President Emeritus. Thank you for everything. And thank you to all of our speakers, too, who are spending their weekend with us here. And, of course, the biggest thanks goes to all of you. We wouldn't have a conference without you and your dedication and your passion for this program. So thank you for all your travels and preparation and coming to hear what we have put together. Thank you very much. So I'm going to go into a little bit of some housekeeping. Your badges are your tickets for meals and entrance to the conference. Please wear them the whole time that you're at the conference. There are actually a lot of events happening this weekend at the hotel, and so that's another reason why you really need to wear your badges. We will be serving lunches like last year, family lunches and dinner family style. We hope this gives you more of a choice, and if you need help with the serving, please ask any of the banquet staff because they are here to help. And hold on to your raffle ticket because we will be doing some raffle drawings tonight and some at the end of the day. And thank you to everybody who brought baskets because that's always a really fun part. Tomorrow we will be featuring our third Meet the Members. Amy has lots of artistic materials like she has every year. We'd like you to have an opportunity to tell us about yourselves, your county, your advisory committee, and we will be doing that tomorrow. There will be time this evening and tomorrow to work on your presentation if you want. If your county is not a current member of SECA, please see me or any of our regional vice presidents. We would be more than happy to come to one of your meetings and do a presentation. We will keep it short. We won't take up your whole meeting time. Please don't hesitate to ask. Our first speaker, I would like to introduce our first speaker. One more thing though, if you're staying at an off-site hotel and need shuttle transportation, just go to the guest services. Out here on a little table by the computers is the machine to validate your parking ticket. We were able to secure a reduced rate for parking for this conference, but it's not down to zero. So go ahead and use that machine. Now, I'm really excited to introduce Jessica Rothar. She's our first speaker. Jessica Rothar is the Program Director for State-Level Advocacy and Organizing with Health Access. And boy, has she been busy this year. She has been a lobbyist, policy advocate, and community organizer for 20 years. She's worked on a broad variety of issues affecting public health, child and family well-being, community development, and has lobbied on federal, state, and local budget issues in California and Washington, D.C., and London, England. Prior to joining Health Access, she ran her own consulting firm specializing in policy advocacy for nonprofits and foundations in California. And many years ago, I had the pleasure of attending a week-long organizing training, and Jessica was there, and that's where I met her. And she was a leader then. So without any further words, please welcome Jessica Rothar.
Thank you very much, Cindy. Yeah, it seems like a very long time ago that we did that, doesn't it? So I want to thank you for having me here at your first annual conference for SECA. Oh, it's the 8th. Oh, it's the first time I've heard about it. Okay. So but I'm hoping that SECA is going to become a real force in the annual budget negotiations, because I think you really have the membership that has been a force through different independent living centers, but I'm hoping that you can go forward and really project the voice of the consumer advisory councils into the budget debates going forward. Cindy asked me to talk about this year's budget fight, which I was involved in through an overarching coalition called the HHS Network. How many people here have heard of the HHS Network? Good, okay, so a good number of folks. So the HHS Network came together at the beginning of this year to bring together the voices of consumers of IHSS, Medi-Cal, CalWORKS, child care, senior services, services that are targeted to communities of color. And the idea was that every year we have been seeing cuts to our programs, and the other side wins when we fight each other for pieces of an ever-diminishing pie. And our goal was to articulate a vision for a strong health and human services safety net in California and tie that explicitly to the jobs argument that, because of the recession, was clearly becoming the only argument that policymakers were going to listen to. And we also wanted to be very explicit that California's budget crisis requires that we raise revenues, that we've been starving the state of revenues for a number of years, that our budget process is broken in a way that ratchets down spending every year because they can cut spending with only a majority vote, but they can only raise revenues with a 2/3 vote. And so the three things were really coupled together. We want to save health and human services. We want a strong safety net. To do that, we need revenues, and doing that will also be essential to creating the jobs that California needs to get out of the recession. So the HHS Network, the leadership of it, is comprised of 4 organizations that put money in to fund it. My organization, Health Access California, which is a statewide consumer advocacy coalition that works on expanding access to health care for all Californians. California Partnership, which is a coalition of groups giving voice to the needs of low-income communities. Western Center on Law and Poverty, which many of you know because they do the really critical work of delving into the legal issues surrounding programs like IHSS and Medi-Cal. And also the California Immigrant Policy Center, which speaks for and defends the rights of both documented and undocumented immigrants in California. So this thing just kept growing and growing. And we started small. How many folks came to one of our, and this is probably only folks from Northern California, Bay Area, Sacramento would have done this, but how many folks came to one of the HHS Network Capital Action Days that we started doing, right? So you were there, you were lobbying, doing ledge visits, going to hearings, and we were also working with media and trying to get media, because in the end, the best way to pressure legislators is to make sure they're hearing it not just from us in their offices, but also through their local media. So I think some of the really powerful work that we did was to bring people with disabilities together with the groups that represent seniors, the groups that represent children, the groups that represent moms on CalWORKs, and to have everybody together with a united front. I think one of the challenges going forward for us that I would like to, I'd like to get your thinking on and have maybe some conversations happening at this conference, and then maybe when we're meeting again on the November 19th to have a planning meeting for next year with the state budget. And Jessica Lehman, I don't know if Jessica is here yet, I know she's going to be here later, but Jessica Lehman represents the CFILC on this HHS Network field team. Also Jameson Lingle, I don't know if Jameson is here, but Jessica, as you all probably know, is a huge leader in the organizing for IHSS and people with disabilities. And so one of the questions is, philosophically, I'm going to take it into the realm of philosophy for a minute. It is disgusting that any cuts should be made at all in programs like IHSS, Medi-Cal, CalWORKs, childcare, when at the same time they grant giant tax breaks for wealthy corporations where there's no explicit tie to jobs. Yep. So you cut $100 million out of IHSS because IHSS is spending too much, and then you turn around and you give a $30 million tax break to Don Fisher's sawmill up in Mendocino County, the Fisher family that owns Gap. I think that's just wrong. How do we talk about that moral issue in a way that can win? Let me take it back from the philosophy. That was a bit of a preview of what I want to talk about later. But in the end, I don't know how other people see this year's budget. What we ended up doing with the HHS network was, as far as the legislature was concerned, we won. I think that we did an excellent job because the Democrats held firm in their negotiations against cuts to Health and Human Services. The conference committee report was very much something that we could live with. Given the enormous budget deficit, it was something that really made, it protected services for consumers. The cuts that it did make were cuts that were made through processes that we felt we could live with, the stakeholder process in IHSS, where there is a certain amount of smoke and mirrors in budgeting, and if the choice is between massive cuts to direct services and smoke and mirrors, I will take smoke and mirrors. Our theme with the HHS network was survive to thrive. The best case scenario